Welcome back. School shopping for kids will look a little different this year. Alongside pencils and notebooks, a lot of people will be packing masks and hand sanitizer. We know a lot of people connected to schools, parents, students, teachers are eager for the best medical information on masks and on children spreading the virus. So let's check in with two infectious disease specialists, Dr. Lenora Saxinger and Dr. Zane Chagla. And I know to both of you, these things keep changing, the analysis, the data, so let's keep that in mind. And let's start with masks, a difficult topic. Dr. Saxinger, how effective are masks in keeping schools safe from COVID?
I think that's the million-dollar question. I think a lot of us think that masks are plausibly going to be useful, but we would never want to rely on them instead of the other measures like reducing contact numbers, increasing physical distance, washing your hands a lot, having good ventilation in the space, and all of those things, because we don't know the degree to which masks might offset the risk of infection in the classroom. So I think a lot of us are looking for more data to evolve to help us see how much masks add and if they can actually replace those other measures. At the moment, we can't say. And we also have to keep in mind that masks can be a bit of a detriment to communication as well, and that's sometimes important in schools too.
Dr. Chagla, why don't you weigh in on this?
Yeah, I agree with Dr. Saxinger. There's a hierarchy of infection control measures in hospitals and in healthcare settings, and similarly in schools. Preventing and screening people for COVID-19 and keeping community rates are low are probably at the biggest end of that pyramid. The ventilation, the cohorting in the classroom, the distancing are kind of in the middle. And then kind of on the top of that pyramid, that little bit left, there is the masks, which may offer some benefit, but without those big pieces underneath, they're not effective on their own. And really, they should be a part of that bundled set. Those need to be optimized before masking is considered as part of it. So they may offer a bit of benefit. There's school systems that have used them, and there's school systems that haven't, and both have had successful stories. But certainly, as part of that bundle, it could be considered as another step.
Dr. Chagla, let's talk about another big topic that a lot of parents hear kind of conflicting messages on, and that is the extent to which kids, especially kids under the age of 12, are susceptible to getting COVID-19 and spreading it. What do we know about that kind of as of this week?
Yeah, this is obviously evolving through the outbreak. And I think at the beginning, we saw children, very minimal amount of children infected when the outbreak was mainly in China and Italy. As it's progressed, we are seeing children affected. I think the data still shows that children are getting it less than adults, that they're less complicated than adults, other than some rare children that get some complications, and that they're less spreaders than adults. Adolescents probably do approach adults in terms of their ability to spread, but those younger children are probably less so in that sense. The question is when you start schools, when you have young children together and there's potentially transmission in the schools, how does that affect the population in terms of transmission in a bigger level? And does that dampening down of less effect of transmission or less effect of transmitting to others have big population effects, or is it very localized to little school outbreaks?
And Dr. Saxinger, what's your opinion on this issue of kids under 12?
Well, I think that kind of comes down to a question of, for parents, do you feel like you're putting your kid at risk by sending them to school? And I think in a lot of places, school probably should have a similar safety profile to the rest of the community. And so if your community is okay, your school's probably okay. The difference is that there's more people together in a space. It is unusual, but it appears to be true that kids are a little less likely to acquire severe disease and a little less likely to spread disease than other respiratory viruses, where usually they're completely the plague rats and they spread everything. So that's a bit of an unusual feature, and I think we're going to have to keep on reviewing data as it comes in. But I don't think schools will likely be a big risk to children. I do think that we're going to be paying attention to whether or not having schools open influences or amplifies disease in the communities around the schools as well. So that's going to have to be sorted out as we work through it. I think it'll be an evolution of understanding over the fall.
I want to squeeze one more topic in here. We only have about a minute, but the actor Ryan Reynolds sent a message to the people of British Columbia. Let's play some of that.
I hope that young people in BC don't kill my mom, frankly, or David Suzuki, or each other. My mom, she doesn't want to be cooped up in her apartment all day. She wants to be out there cruising Kitsilano Beach looking for some young 30-something Abercrombie burnout to go full Mrs. Robinson on.
We have probably only about 20 seconds for each of you, but let me start with you, Dr. Saxinger. How concerned should we be by the increase in the number of cases we're seeing in BC and I think in Edmonton as well?
Yeah, Edmonton and BC are both kind of hotspots right now, and I think that we're thinking a lot of that is due to probably more socialization and mostly in younger people. And that is a concern because it makes me feel like there's a simmering pot that could boil over, and we know that when COVID boils over, it can be very severe. It can really take off quickly. So I think we have to look at measures to go back to the basics and do them very, very well to prevent further community spread and get a lid on it before schools are due to start. I think that's very important.
20 seconds, last word to you, Dr. Chagla.
Yeah, I mean, I think this is a high-risk population that we're struggling to deal with public messaging. Ryan Reynolds today is a fantastic example of how public messaging actually can work. I think all of us looked at that, had a good laugh, but had a good shake of our heads in terms of transmission in that age group. So I think innovation, like thinking outside of the box and having folks like this actually speak up may actually be great to help dampen the spread in that population.
Well, I really appreciate you and the other infectious disease doctors stepping forward and helping us understand the changing environment here. Thank you very much.
Thank you.
All the best.